Hello everybody, it's Rhian here from Not Just Facts, and I am going to continue today talking about the knee joint, and we're going to talk about some dysfunctions and pathologies within the knee joint that can happen. So I suddenly thought about it because I said last time that I'd speak about a few, but they are quite in depth, so I'm going to just talk about one. I'm going to share the screen, and that one is patellofemoral dysfunction. Now, I'm talking about this because we see this a lot in practice. It's probably the most common thing we see with a knee, and it's very treatable, in fact. So you get pain at the front of the knee with this, and it's common in adults, particularly ladies, and also children. Now, if you remember back to our anatomy last week, here's the kneecap, which is the patella, and then the femur, which is the femoral bit, is the thigh bone coming down from our thigh to our knee. So it's that joint, the patella on the femur, rather than the tibia and the main hinge joint. So we're not talking about the hinge joint here. Let's go. I'm just going to take you back to this picture because I want to show you, just highlight that cartilage on the femur. So the cartilage comes up quite high. So then the kneecap can then run up as the knee bends. The kneecap can then run up and down the knee. So just to point out how high the cartilage comes up the head of the shaft of the femur. Well, not really the shaft's there, but into the head of the femur. So what causes this patellofemoral pain syndrome? Well, there are a few things. First of all, it's about alignment. So you might have a kneecap that's not aligned properly, and this is generally caused by problems with the quadriceps muscle. We'll go back to the picture. No, not that one, that's the bursa. So we go back to the picture here. We have 4 muscles in our quadriceps, quad, meaning 4, like we said last time. And so here's the lateral, this is the outer aspect of your thigh here. This is the inner aspect of your thigh, the medialis. And then you've got your rectus femoris, and then underneath it, the intermedius. There's 4 heads. Now, generally, when we get a weakness, it tends to be in this inner aspect of our knee. So this knee, this muscle here gets weaker, and then the kneecap then ends up being pulled more to the outside of the leg rather than being positioned nicely in the center, because the kneecap has to run along like a track to go up and down. And then when you have that imbalance, the kneecap can then get pulled to the side and it doesn't run on its track so much. So it can rub, show you this picture, this cartilage underneath it. So if you imagine it's being pulled outwards, so the kneecap's here, and it's being pulled outwards, then it doesn't run in its track, and that can cause some discomfort within the knee. Also, you can get an imbalance between the hamstrings, which is the back of the thigh muscles, and then the quadriceps, which are the front thigh muscles, and that can cause issues as well. Certain anatomical alignment of the knee can cause, or the leg can cause problems. So if you are knock-kneed, here we go, genu valgus, your kneecap can then again end up being pulled a little bit more to the outer edge rather than in its track, and so that can rub and cause pain. And also with knock-knees, you tend to have flat feet. So if your feet are dropping, your arches are dropping in, you can then also end up with pain in the front of the knee. Another cause is being overweight. Obviously, being overweight, you load your knees loads being overweight. So then that can cause more tension held within your thigh, and you tend to maybe hold your knee slightly bent so that your thigh muscles are always working. That means and when your thigh muscles are working, because, let's just show you again this picture, because the kneecap is a sesamoid bone, it floats within the muscle, that then the muscles tight, they pull the kneecap back towards the femur. and it then rubs, and that can cause pain as well. And the last thing, so muscles, if muscles are too tight, so again, that's what we've just described, and ligaments and tendons are too tight, then they can cause issues. And also, conversely, if they're too loose, so people who are hypermobile, where the kneecap is just floating around too much, that can cause issues as well. So it's harder to, it's always harder if somebody's too loose, because obviously if somebody's tight, as osteopaths, we can get their joints working and loosen them up. Whereas if somebody's too loose, you can't then get them to become tight. And obviously you need exercises and different guidance when you're too loose. So what are the symptoms of this pain? So you get a deep ache, generally behind the kneecap, or in front of the knee. You'll notice your pain worse after activity, especially if you're doing squats and lunges. It's like a runner's knee, it's called as well, jumper's knee. So all those sort of activities. And you can get pain when you go upstairs and downstairs. Excuse the birds, sorry, there's a bit of tweeting and flapping in the back. They're my birds. Anyway, so you can get pain going upstairs and downstairs, and they always want to talk to you when you're actually talking to somebody else. And then the rest of the day, they'll sit quietly. But the worst pain is generally going downstairs, because, or downhill. When you walk downhill, you tend to load your knees, and I sort of saw in a hiker's journal that you can load up to 7 to 8 times your body weight when you're actually coming downhill. So again, that kneecap then gets really drawn back towards the femur when you're going downhill. And then the other classic thing is getting pain after prolonged sitting with your knees bent. So then you go to get up and you get that ache and discomfort to get going again as you get up. And that's quite a classic one. So how do we treat patellofemoral pain? Well, if it's really painful, obviously you have to rest or reduce the activity you're doing, that's causing your problem. You've got to look at your technique. If you're in the gym or doing some sort of exercise, then you need to look at your technique and how you do it, actually doing it. And if you're doing something wrong, you know, if you're in a squat and you're bringing your knees over your toes, then you're really loading that knee joint and not getting your bottom back and your weight back into your heels, then you will start to get pain in the front of your knees. It's really common. You can use ice and painkillers if you're into painkillers. Lots of people that come to see us aren't, but sometimes you just need the odd 1 or 2. And then you can find strengthening and stretching exercises all over the place on YouTube and stuff like that. Foam rollering to roller out the muscles. It's very common at the moment. I've never really got into it, but because you have to get into some weird positions, or you can just roll it up and down like a rolling pin. But yes, it's meant to be very good. And then there's taping, and again, you can go on YouTube and learn how to tape your own kneecap if you're into sport and playing a lot of sport and you get pain, and then you get some funky coloured tape and strap yourself up. So what do we do in clinic for this? So I just had to add a little bit of eye candy for us ladies. Sorry, gents, another day for you maybe. I just want to show you, there's the vastus medialis. Look at that lovely muscle there. Really defined. So we work on balancing the tone within the muscle group. So a lot of the time, all this outer group, the lateralis, is really tight, and we do a lot of soft tissue work and massage to get that softer. Also, even though you get weaker, because we test the muscles, we get weaker medialis, it can get quite tight within that, even though it's weak. It's a bit bizarre, but no, it's not really bizarre. But what I tend to do is do a lot of needling in there. So I pop a few acupuncture pins in. So as you can see down in this picture, so the X's are where the needle goes in the muscles. And then, so in this one here, this is the pain distribution from that needle. So sometimes when I stick pins if you've had knee stick pins in you, you can get then this pain referral into this area here. And then this trigger point then does this area here. But a lot of you will notice that if I've needled your medialis, you'll get a twitch in the muscle, because very active trigger points, they twitch, and then I sort of wiggle the needle around a bit until the twitching fatigues to just relax that off. So I do a lot of that with this sort of thing, a lot of needling. And we articulate the patella, because sometimes it can be quite restricted. So we get it moving again and working and getting the knee joint working in to improve its function. We also look at the feet and the hips, and we mobilize those, especially the feet, because a lot of people have been walking in a certain way for so long that their joints are really held and stuck. So we want to try and get you sort of heel striking and toeing off properly, so that then the forces go up your leg to your knee properly. And obviously with that, we talk about footwear, because obviously trainers, if you're exercising, even if it's just you do walks, are really important to prevent knee problems. So sometimes people come in and the shock absorbing bit's gone in their trainers and they haven't realized, and then they start getting pain. Or it's just the fact that they're just, old pair and they've just had it and they've completely collapsed. Or we talk about if you need orthotics and need to be sent to somebody, a podiatrist, for further help with getting the arches right, because once the arches are right in your feet, then your knees will align properly with your hips. So it's quite important there. Now, I'm going to go back to this because it just reminds me of your hip alignment. This Q angle, I didn't mention that. So why women get it more so than men is because we have wider hips and then come down to a more narrow knee. So you can see that this normal angle is 15 degrees, whereas men don't have such wider hips. They don't have this bigger Q angle. And so it's just about forces really coming down into the knee. So that is it for anterior knee pain. I will come back to knee arthritis because it's quite a big topic to do, and it will probably take a few. But next vlog will be about some exercises to help with keeping your knees healthy and the muscles balanced. So I will see you next week. Thank you for listening and take care. Bye-bye.